So to continue the discussion around the marketing tactics of big tobacco in the regions of our world, we're going to move on to a moderated discussion now that will be led by Aditya Indla from the Anti-Vaping Advocate and Jim America's core team member. Over to you.
Hi, everyone. My name is Aditya Indla, and as you just heard, I'm an anti-tobacco advocate, and I'm a youth myself, so I'm a part of the people who are being targeted by these products. And so I wanted to help lead this discussion on how the world industry, tobacco industry, interferes and markets its products to children, and why it's really so important for youth to be aware of these strategies and what can be done about them. And so first, we're going to start off with a few short presentations, and then afterwards, there'll be a 10-minute Q&A where you can ask questions and get responses from these people. And so our first speaker is Barbara McGaw, the project manager from the Heart Foundation of Jamaica.
Okay, can everyone hear me?
Yes,
okay.
we can hear you.
Great, thanks. I'm glad that we got Bonnie as a starter, because she really did put in place, you know, the whole issues of marketing to children. I was able to look at some data, but it is not so obvious in the Caribbean. One of the reasons is because of the advocacy of the Coalition for Tobacco Control and the Healthy Caribbean. We have been able to sort of reduce some of that, but the policies are not in, there are not that many policies in place. Anyway, let's go into it next. Just some pictures of our young people, hookahs, e-cigarettes next. And these are from social media pages in Jamaica. Next. Okay, so we talked about policy and we talked about, you know, ways to protect the children. There are several treaties and conventions that have the power to protect children. Of course, the WHO framework, the United Nations Conventions on the Right to the Child. Nicole did talk about this earlier, the Sustainable Development Goals. But the Port of Spain Declaration, which was done in the Caribbean in 2007, actually speaks to banning the sale, advertising, and promotion of tobacco products to children. You know, we've had some success, but certainly not as much as we would like. Next. So I looked at the Caribbean laws that protect our children in several countries in the regions. The ones in red, Jamaica, Trinidad, and Guyana, are actually that childcare law has something that relates to tobacco, that is an offense to sell or serve tobacco products to any child. So at least that's good. If it's implemented, of course, that's another story. Next. So there are some disturbing trends in the Caribbean. We are not, as I said, we may not have that much research, but we do have some data. The overall prevalence is about 70% in youth. And when we look at a country by country list, the prevalence rates in youth are actually higher than adults in some countries. And of course, we have had the early initiation of cigarette smoking. Many children start before the age of 10. And the use of e-cigarettes has ballooned over the last, couple of years. The three things that I was looking for company would be the ability company in their possession and cigarettes. Next. Okay, so we're going to look quickly at the Global Youth Tobacco Survey. And this is between youth between 13 to 15 years old. We have had several surveys in the Caribbean starting from 2000. And the data show that 3 to 4 out of every 10 ever smokers, or that disappeared, okay. Yes, initiated smoking before the age of 10, and 50 to 80% of the students reported that they wanted to stop smoking. Next. So this is looking at the Caribbean. The dates of the GYTS is different depending on where we were. Some are 2013, some are 2017. But you can see in blue, the percentage of children were allowed to buy in a store. And in red, the percentage who bought and were not refused purchase because of their age. So this is just to show you that, you know, there is some. Okay, next. Okay, so we're looking at this now. This is looking at the percentage that have an object with a cigarette brand logo of children right through the Caribbean, and those offered free cigarettes by a tobacco company. I'm looking at, for example, Jamaica in 2017, and one of the reasons why the red bar is low is that we had the law, our law in 2013 for tobacco, and we feel that that had some impact. Some of the other countries have legislation, but not the tobacco advertising and promotion is still not where it should be. Next. Okay, so this is the Frenchman. It's a well-known party every year in Jamaica around Christmas. This is a lady going around. No, nobody's asking age. Anybody can, you know, have these cigarettes. Next. So we talk also, Bonnie did mention this, they have something called a youth smoking prevention program. And this was launched some years ago. And the objective, of course, is to prevent the purchase of cigarettes by persons under 18. But the studies have shown that it doesn't prevent anything, because as Bonnie said, you want to be 18. Oh, don't smoke until you're 18. Of course, you're going to smoke, you know. Next. So this is happening in Jamaica, Barbados, St. Lucia, and Trinidad, not just Jamaica. Lately, though, I think that these programs have been put on hold because I haven't been able to find out anything lately about that. Next. So we come to corporate social responsibility. Carreras, which is a subsidiary of BAT, gives scholarship, academic scholarships. And they've been doing that in Jamaica for about 5 years. In the center of this picture is the Minister of Labor and then the head of the tobacco company. And of course, lovely students who are so excited. 42 scholarships at 7 million. Next. Again, in the last 3 years, there's been about 30 million Jamaican dollars annually for scholarships. And each year there's always a picture, either the Minister of Education or the Minister of, you know, other ministers, which lends, you know, credibility to the whole issue. Next. So this is it. This was a statement from R.J. Reynolds, because again, because of that master suit, we were able to get data. So they're saying they represent tomorrow's cigarette business. As this 14 to 24 age group matures, they will account for a key share of the total cigarette volume for at least the next 25 years. So, you know, once you have them, they're hooked. And I just want to end by saying, in protecting children from tobacco, it's essential to restrict all tobacco advertising, promotion, and sponsorship, and take steps to normalize tobacco-free lifestyles. Next. Thank you.
Thank you so much for this amazing presentation. I think it's honestly kind of disturbing how there's this conflict of interest where they're targeting youth with even things like scholarships, right? And I think when it comes to issues like this, it's all the more important for organizations like the ones you run to actually call these out and fight back. And so our next presentation is from Mariana Pinho, who is the coordinator of the Tobacco Control Project and the ACT Health Promotion.
Thank you, Aditya. Everybody's seen the slide? Oh, thank you. Well, I would like to thank Aditya, Danielle, and all involved in this workshop. I'm really glad to be here with Barbara and Gustavo and with you all from GYM. And please feel free, Aditya, to send me a message when I have just 1 more minute, okay? First of all, I've thought it would be a great challenge. Sometimes the tobacco control community think that Brazil reached great results in public health related to tobacco control. And it's definitely true. But it does not mean that we don't face problems nowadays. and marketing, for sure, is one of them. Every year, smoking kills more than 8 million people worldwide. In Brazil, in just 1 year, there were 161,000 deaths, and it means 443 per day. So, as we saw in early presentation, despite tobacco companies argues that their products and campaign will not be aimed at young people, numerous of the document industry internal documents shows that tobacco companies target them in their actions. Studying their habits and certainly developed products and campaigns advertising aimed at them. Next slide, please. And how is the tobacco advertising and promotion and sponsorship regulation doing in Brazil? Well, since 1996, Brazil has been enacting federal laws to restrict tobacco advertising until its total ban on mass media in 2011. By this way, the commercial tobacco advertising is totally prohibited, with one exception, is the exposure of tobacco at points of sale. So the packs of cigarettes can be exposed at the point of sale. And also Brazil is a FCTC party since 2006. So we are under their measures. These steps about taps regulation in Brazil to the totally ban reach great moments. One of them related to the marketing restriction is that between 1989 and 2010, 14% of the reduction of smoking prevalence was related to the marketing restriction in Brazil. So it's how we see how the importance of the marketing restriction measures. The sales of tobacco is prohibited to anyone under 18 years old, but unfortunately, 7 out of 10 teenager smokers in Brazil have tried to buy cigarettes. And of those, approximately 9 of 10 were successful. About 45% of all Brazilian smokers between 13 and 17 years old reported having regularly purchased their own cigarette without any preventions. Anyone was banned this action. Next slide, please. Here is a communication map, and tobacco advertising, promotion, and sponsorship could be made in a different approaches, directly, indirectly, since the depictions during a film, a streaming film, up to corporate social responsibility activities. And they have in an integrated ways and potentialize their effects, of course. The tobacco industry is looking for ways to circumvent legislation, promote its products, and create sales, especially to young people. Then, unfortunately, we still have many violations of the federal law in Brazil. Please, let's remember something. Seeing the next pictures, it's not allowed taps except display at the points of sale. It's not permitted colors, lights, images, or other communication strategies in the exhibition of the packs at points of sale. And the sales to minors are also banned. Remember that. Next slide, please. Here we can see violations. Vending machine on the middle of the slide stands like points of sales in musical and cultural festival because stands are not considered points of sale. They can be today here, but after the shows, we don't have the stands anymore. So it's not points of sale under the law. We can have colors related to brand, the name of brands. So here it's horrible images and pictures, lots of violations. I should add that the exhibition ways should be with the healthy warning labels and the table of prices, not using logos and brands mentioned in it. We cannot see these roles being using in the points of sale in Brazil. Next, please. The internet is working as a new point of sales because we can, I don't see the next slide. I'm not sure if all, oh, thank you. Users of platforms, not only tobacco industry, users of TikTok, Instagram, Facebook, they are promoting tobacco products, new tobacco products as e-cigarette or heated, not burn products. And we also report that delivery application are offering tobacco in their platforms. So we have here in Brazil, Rappi, iFood, Uber Eats, they are offering tobacco products. And sometimes there is no limit of age to be a user in these platforms. And it's not permitted in Brazil. It's another example of violation. Next slide, please. Sales of tobacco are being reported to be done with gifts and collectible items, or sales of items similar to tobacco products like this one with Marlboro. It's a USB hub for USB to be connected in it. Tobacco industry also insert ads into the cigarette packets, like this one on the right. You can see a pack of cigarette with this label, and it's a promotional piece. And this one in the Marlboro packs, they have they inserted a paper talking about its products. Next slide, please. The entertainment and television, despite the banning, are in important way to tobacco industry. Had your product promoted. Oh, sorry. Oh, I'm wrong. This one, it's about the packs. It's how they are similar among packs of cigarette and candies and gums. Like you can see, the LM and Trident and Halls, they are using the same color, and the purpose is to have a similar to the young people. And those one, it's using famous characters and printed in the packs. And in the bottom of the slide, we have flavors. Flavors, as Barbara said, and Dr. Bonnie said, it's an important way to facilitate the experimentation among boys and girls. Next, please. Here, the entertainment and television, despite the banning, are important way that tobacco industry had your product promoted. Sometimes it's not the tobacco industry, we know that, but unfortunately the television channels allows the exhibition of those products in soap opera, serials, shows, and others. In the right, we have a picture of a sponsorship of a musical event made by a novel products brand. Next slide, please. I would like to make a specific note about corporate social responsibility activities in Brazil. Maybe you don't know, but Brazil is the third largest tobacco producer in the world and the largest exporter. About 85% of tobacco production ships from Brazil and lands in Netherlands, China, and the rest of the world. So the industry roles with the producers is very strong. And those activities, their plan includes their children, of course. So they develop management and work programs for young apprentices. They have actions to protect the environment and health, and develop education activities with young people. And most of these pictures are reported by the tobacco industry. Next, please. Oh, there is something else. And during the COVID pandemic, for example, there were numerous of CSR activities as donation in money, donation with suppliers to like alcohol. And there's something we should know and have in mind. This kind of promotion, it's a way to advertising and promotion the product and should be banned here in Brazil. It's not included in the banning. Thank you. So considering that advertising, no, can you back to the, yes, thank you. Now the back one. That advertising is one of the entry point for smoking for young people. We must alert and report violation to the authorities that they could fulfill their duties. Campaigns and information such reach different audience about the tobacco industry strategy to engage new and young consumers that should be informed about that. Invite young people to advocate, like here in this workshop, in favor of tobacco control is also a key action. We must join efforts to denormalize smoking and propose further advance in TAP's legislation, include a ban of the display of products at points of sales and social responsibility actions. A very, very effective measures to protect young people from experimentation is to raise prices and taxes. Is the most effective, cost-effective measure in tobacco control. In addition, promoting health environments with harmful products away from school and leisure spaces should also be encouraged. And also seek the implementation of the rules that prohibits the use of additives in tobacco products, as well proposing that standards, that plain packaging could be adopted for these products. And we in SCT, Health Promotion, have been doing campaign and doing advocacy with the National Congress and other action in this regards. Could you please go to the next slide, and have management and mobilize in favor of health protection and smoking prevention. Here is some example of have been doing partnership with others. We have a report in this pink one on the left, a report about the apps, delivery apps, and other campaigns we have here. I sent to Danielle a link for this video, Vaping is Addictive. They have subtitles in English. Maybe you can go there after. And lots of campaign material we have in our website. Next, please. Well, thank you. I appreciate lots of to be here and share with you the violations in TAPs in Brazil. Thank you.
Thank you as well for bringing up issues like this, especially with influencers and entertainment marketing to youth. I know that's definitely a big issue I've seen even here in the US as well. And so we have our next presentation, which is Gustavo Torrez, who's the Director of Youth Advocacy from the Campaign for Tobacco-Free Kids.
Hello, everyone. Aditya, Danielle, and the entire planning committee, thank you all so much for this opportunity for us to all be here today. As Aditya said, my name is Gustavo Torrez. I'm the Director of Youth Advocacy at the Campaign for Tobacco-Free Kids. We are an advocacy organization who is celebrating its 25th year in fighting big tobacco, not only here in the United States, but across the globe. I am based in Washington, D.C., here in the United States, so it's great to speak with you all. So today we're going to talk a little bit about the tobacco industry, some of the marketing, but specifically some of the industry interference and how they are interfering in the work we are doing to create a healthier, just community, not only here in the US, but across the globe. I started off in tobacco control as a youth advocate myself. And as I've continued into my professional career for the past 25 years, there is one thing that I can definitely say: the tobacco industry has been consistent in their predatory marketing practices, and they continue to evolve and transform. But the one thing that is consistent, they are selling a product that, when used as intended, could potentially kill you. But more importantly, they're selling a product that is designed for addiction, whether it's combustible tobacco or e-cigarettes. These products all contain nicotine. And as we know, nicotine is addictive. So when we go on to the next slide, we'll look a little bit here in the United States. You can see major tobacco companies spend $8.4 billion a year. That's over $23 million every day to promote their products. And their marketing efforts, as we've seen from the previous presentations, are definitely reaching young people. This is, they understand that kids are their target market. And while we continue to create laws and policies that restrict some of the target marketing of the tobacco industries, they continue to find ways to circumvent these policies and combat these policies, because again, is they are putting profit over people, especially our young people. So when we go to the next slide, what we've seen, so Philip Morris in the United States changed its name to Altria. By changing its name of their parent company to the Altria Group, Philip Morris, their whole idea was to create an illusion of change, trying to hide from its past while avoiding the real change and harmful business practices of which their foundation has been built upon. And one of the things that we've definitely seen by Philip Morris changing their name, it didn't prevent a single kid from starting to smoke or save a single life, because the company continued to engage in harmful tobacco practices, which is the reason why we are all here today. We know their product addicts kids and they continue to aggressively market to fight public health policies that really reduce their tremendous harm that are caused by their products. So when we go to the next slide, we see throughout history, sorry, if you could go back one. You've seen throughout history, the industry has a history truly of lies. And the reality is they continue to sell cigarettes as their primary business, not only here again in the US, but across the globe. They spend billions on their marketing each year, and they aggressively fight policies that actually reduce smoking. So again, it's very counter to their efforts. So when we go to the next slide, we start to fully understand a little bit further what Altria now is saying. They say kids should not smoke, vape, or use any tobacco products, but the reality is they're selling the #1 cigarette brand amongst kids, and they own 35% stake in Juul. We've also seen for other tobacco companies, multiple of them each have e-cigarette type products, which are again very counter to the narrative of trying to create a smoke-free world. what we're actually doing is creating a product that continues to addict young people. And even early research shows that young people who use e-cigarettes have used or are more susceptible to use combustible tobacco products. On the next slide, we start to see a little bit more about, in tobacco's words, what Altria is saying, about moving beyond smoking. But the reality is as we all know, in the US, 93 billion cigarettes have been sold. Over 93 billion cigarettes have been sold in 2001. And again, 88% of their revenue is from cigarettes and cigars. As we continue to the next slide, we see that the tobacco industry has not just sold this product here in the United States, but as they've grown across the globe, understanding that their market is so much greater if they can reach more kids wherever they are. In their efforts of even trying to say we're trying to create a smoke-free world, the reality is over 625 billion cigarettes have been sold across the globe in 2021. And that's 79 cigarettes for every person on the planet. So when we think about this industry, and we go to the next slide, we understand that they are truly continuing their same targeting practices that they've done in the past. So if you click through some of the animations, you could start to see tobacco advertisings from the past and new tobacco advertising that we're seeing here in the future. And on the next slide, it really starts to draw the true parallels of the tobacco industry in their marketing of flavored tobacco products, the reinvention of themselves here in the United States, trying to hide from their past. But the reality is we're continuing to see the same thing in their industry marketing and advertisements, from tobacco products to e-cigarettes. And ultimately, beyond the advertising, the tobacco industry continues to interfere with public health strategies that are proven to reduce the negative impacts of big tobacco. They're doing this in multiple ways by funding opposition efforts and opposition groups specifically, supporting these industry front groups to undermine tobacco control policies, doing faulty research or skewed research that does not tell the true story of their work. They lobby for industry, and they are lobbying to promote low impact or ineffective policies, or even counter policies that help to prevent their negative impact, because again, that impacts their bottom line, which is the money, which is the one thing these industries all care about. So for us, and we're thinking about encountering these efforts, it's important for us to continue to expose and identify tobacco industry bad acts, identify and expose the monetary influence, the money that they are giving to whether they're trying to do it through scholarships, or the money that they're really giving to our elected officials to buy their votes, to support their product, to ensuring that we as advocates are correcting the misinformation that the industry is putting out there, trying to talk about their product in a positive light. That is what we as young advocates need to continue to do. And lastly, really raise awareness of these industry strategies and continue to bring that to the forefront, so they cannot hide from their past, as we are truly visioning, looking forward to a healthier community. So with that, thank you all so very much for inviting me to be here. There's a variety of slides that Aditya could just, or that we could just move forward with to show specific advertising that we're seeing within e-cigarette industry today. But again, thank you all. And with that, I'm going to turn it back over to Aditya.
Thank you, Gustavo. Yeah, it's definitely really interesting to see they're just using the exact same tactics from before and trying to still get people in. And it's like you said, it's really important for us to call those out, get youth involved, and really try and fight back. And so now we have an opportunity for a Q&A with all four of the previous speakers, so McGaw, Ms. Pinho, Gustavo, and Dr. Halpern-Felcher. And actually, I had a quick question myself for Dr. Halpern-Felcher. So as someone who works in tobacco prevention, right, what exactly do you think about the tobacco industry themselves getting involved in their prevention, right? How exactly does that conflict of interest really manifest?
Yeah, thank you for asking, and I'll be brief. Somebody mentioned that in one of their talks. I can't remember which one. Sorry, but I think it's a really good point, and we actually experienced this with Juul Juul creating their own tobacco prevention or Juul prevention curriculum used in the U.S., particularly in California. And we actually, in my lab, published a paper analyzing the curriculum and showed how bad it was. And in fact, they had also stolen sections of our curriculum for theirs and others. So I just want to raise that as it's really important for everybody in this audience, whether you're young people, educators, policy folks, whatever, to be aware that that is one of the ways that the industry works, is that they try to create their own prevention program and in turn say, we're trying to prevent, when what they're really doing is going into schools, going into homes, going into community-based organizations and promoting their products and not doing a good job in preventing and again, having the opposite. It's another form of marketing and advertisements. And in terms of the conflicts of interest, just to reiterate that, there are a lot of times, it's not just the tobacco industry, but academics. Some of my colleagues who are professors in various universities, I'm not going to call out names, but they will work with the industry and publish a paper and not put that they are working for or paid for by a particular industry. So they're doing some of the sham research that Gustavo mentioned as well. So just be aware, pay attention, because you can't always tell. And in fact, one paper from a colleague got retracted because he didn't disclose that he was working for the tobacco industry. So really, really important to just pay attention to sort of the fine lines and everything that you're reading, looking at, doing, and deciding whether or not to use.
Wow, really great answer. Does anybody else